Hello and welcome to Loci Mania. Pericarditis is today's topic, and we're gonna start off with the name. The name itself explains what it is. So peri means around, card means heart, and itis means inflammation. So basically it's saying to you it's inflammation around the heart. You have the definition, which is a sac-like membrane around the heart filled with blood or fluid or anything else that makes it harder for your heart to pump out blood. You have different types. Everything under 6 weeks is called acute, everything above 6 months is called chronic, and everything in between is called subacute. You can see different kind of symptoms in this patients. You will see chest pain, cutting pain, coughing, and a phenomenon called rib rub, where you have the pericardium rubbing on the rib, and that hurts very much. Going on to complications and causes of this disease, you'll see that we have a complication called constrictive pericarditis. And this is when the pericardium loses its elasticity and leads to shortness of breath and edema around the body. And in the end, you will have to do a pericardiectomy because the pericardium is not effective or not needed for the heart anymore. Another complication is cardiac tamponade, which is very serious, a very serious situation where it could lead to a fatal situation with the patient. It's a fast accumulation of fluid in the pericardium, and you have jugular vein distension, hypotension, and very often seen pulsus paradoxus. Going to the causes of pericarditis, it's a lot of things that can cause it. Systemic diseases like lupus, rheumatoid arthritis, trauma to the heart, AIDS, neoplasms, tumors. You have tuberculosis, infections, could be viral, fungal, or bacterial, but mostly viral. Moving on to the types of pericarditis, you have 5 different types, and all depends on the kind of a fluid you have inside the pericardium. I call it PSFHC, as you can see on the top. And you have purulent, which you can see in abscesses, serous and skin blisters, often seen. Something called fibrinous or also uremic, and usually you can see that in adhesions from past operations. Hemorrhagic, hematoma, normally. And catarrhal, which is runny nose fluid, as you can probably imagine. Moving on to diagnosis and treatment, in ECG, which is our first diagnostic procedure, you will see ST elevation in all leads, which is important to remember, because in myocardial infarction you will have an ST elevation in the affected parts of the heart. In pericarditis you will see it in all leads. You will see some fluid in the echocardiogram, which will help you diagnose that fluid is in the pericardium, and CT scan to exclude any other differential diagnoses as pulmonary embolism and aortic dissection. Treatment, you will see that aspirin, ibuprofen will help the patient. Colchicine, which is a medicine that helps reduce the inflammation in the body, will help, and if not, you use corticosteroids like prednisone, and that will probably help. In severe cases, you will have to do a pericardiocentesis, which is very common in the cardiac tamponade, where you inject you put in a needle in the pericardium and you aspirate the fluid. This may have to be done more than once during several couple of days. And then you have a pericardioectomy, which you have to do when you see that the pericardium is too rigid and not helping the heart pump anymore. Our last slide is a mnemonic for you guys to memorize. Peri, P-E-R-I. So P for pain, which is positional and pleuritic. It changes with the position and the breathing rate. E for elevation in ST in all segments. So all leads you will see ST elevation. R for remove the fluid, pericardiocentesis, and I for infections, viral, bacterial, and fungal, mostly the viral, as you can see. Thank you very much.